Hello, everyone. We just want to thank you all for taking the time out of your busy day to join us in this Zoominar. This Zoominar is to provide supplementary information as well as a place for discussion regarding EVS or environmental services in cleaning and disinfection, specifically for healthcare settings. Although we have designed the material for EVS technicians, we believe it is important to open this up to everyone on the healthcare team, as this will help provide greater clarity into each other's roles in order to be an effective team, especially when combating infectious diseases. We would like to first acknowledge that we are presenting from the traditional and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. And this is us, the IPC team. My name is Daniel Chan.
And I'm Tess Giuliano.
And we make up FNHA's IPC team. We have sent out a pamphlet and brochure about our team, regarding the services that we provide to a lot of the nursing staff in community and in FNHA, and as well as to other stakeholders. If you have not received this brochure, feel free to email us at ipc@fnha.ca, and we'll be more than happy to send you a copy so that you know what you can ask us for. We would like to note that the information provided in this presentation is to supplement the training that EVS technicians have or will receive from their occupation or from their employer. It is also to help add to the clarity around their valuable and vital role in healthcare. So in this presentation, we'll cover what is EVS. EVS is the abbreviation for environmental services. You're going to hear this terminology, this abbreviated form, EVS, a lot. It'll be EVS this and EVS that throughout this presentation. Also, we're going to talk about the importance of EVS, the cleaning and disinfection methods, the frequency of cleaning and disinfection, the differences between routine and additional precautions cleaning, and how to clean, just some basic concepts around there, how to protect yourself in regards to PPE and other protocols, and the resources that are available to you. We'd like to start with a more global perspective, as it can help with understanding current challenges in infection prevention and control measures. Our world today is very different than before. We have greater population. We have much more urbanization as well as more densely populated cities. We have deforestation, which disrupts the natural habitat of animals and insects. We also have climate change, which is a big focus in the media right now, climate change. And it is very important because it also affects the natural dormancy or barriers for vectors like mosquitoes. We have political and economic conflict, which influence behaviors and choices of people, like where they live, what they eat, sanitation, availability, healthcare services, etc. We also have a continuation of a problem of the misuse of antibiotics, which leads to a greater resistance of bacterial pathogens, being bacteria that causes diseases. And of course, the interconnectedness of all continents due to greater efficiency in world travel. You can pretty much get anywhere in the world in about 48 hours. And of course, so can pathogens. The CDC, the Center for Disease Control, determined that a disease-causing microorganism or pathogen in a remote village can potentially spread to all major cities around the world in about 36 hours. This is truly outstanding and significant because there are communicable diseases that have a longer incubation period than 36 hours. The incubation period is the number of days between when a person is infected with a pathogen or disease-causing microorganism and when the person will show signs and symptoms of that disease. And therefore, a pathogen can travel to all parts of the world before we even know someone is infected. Can anyone tell us? You can type it into the chat box here in Zoom. What is from your knowledge, what is the average incubation period of COVID-19 is? We'll just take a few moments here, or take a moment here for everyone to enter their answers into the chat box. If you don't know, that's okay. All right, so a lot of, actually everyone got it right. From our current understanding, it is on average about 5 to 6 days, but as long as 14 days. That's why you can see a lot of the isolation measures go up to 14 days because of the potential incubation period of that length. For influenza, it's about 48 hours, generally speaking. So what does this all mean, and why is it important to know? One of my all-time favorite movies is Apollo 13 with Tom Hanks. This was before one of his other movies involving another ball. There was a scene when the main actor, Tom Hanks, looks out the small window of his spacecraft and sees Earth from afar. From that vantage point, the Earth looked very small. In the same way, when we talk about communicable and infectious diseases, this perception of Earth is not only quite accurate, but also important to remember. Because in essence, it's almost like the Earth's almost like a small enclosed system or an office building with multiple floors. The elevators and stairwells being our mode of travel between each of the floors. And that can be an analogy for our planes and ships and automobiles. Therefore, we can almost safely predict that whatever microorganism is in another region, another floor in the office, another part of the world, is probably already here in our midst. And this is what makes communicable disease so dangerously unique. It's not only invisible, not only can it spread without anyone knowing, but because it's everywhere, it affects everyone. And therefore, it has and will continue to be everyone's problem. And how does this relate to infection prevention control, or more specifically to cleaning and disinfection? Everything. We can see Earth as like one big nursing station or health center. Just going over some statistics. Every year, approximately over 200,000 Canadians are infected with what we call an HAI. You probably have heard this term before, a healthcare-associated infection. And what that is an infection that someone got because of their visit to a healthcare facility. And of the 200,000, 8,000 to 12,000 die from complications related to these infections. And believe it or not, HAIs is a fourth leading cause of death behind cancer, heart disease, and stroke in Canada. And it costs a lot to treat. It costs our healthcare system a lot, these HAIs. So why is EVS, or environmental services, or basically cleaning and disinfection in healthcare settings, so important? Well, as we mentioned, that disease-causing microorganisms or pathogens are everywhere. Healthcare facilities are no exception. In fact, actually, they are even more vulnerable to this, because healthcare facilities is where ill people go. That makes sense. Ill people go to healthcare facilities to get help. And so with them, they bring with them these microorganisms with them into these facilities. And so therefore, these healthcare facilities are greatly exposed to these pathogens. Now, this is very significant because without proper cleaning and disinfection, these facilities can place clients who are vulnerable because of their already compromised immune system at greater risk for complications. They may be going into the healthcare facility for one problem, but if the facility doesn't have proper infection prevention control measures, they could be coming out with more than just that one problem or complication. And it doesn't just only affect that particular client. After their visit, where do clients go? They go back home to their families. They go to they go into their communities. They go to marketplaces. And so therefore, it can impact the entire community significantly as well. And therefore, that's why it is very important. The infection prevention control measures, or in this case that we're talking about, the cleaning and disinfection of the environment in healthcare settings, it is so vital. So as we mentioned, EVS is the abbreviated term for environmental services. Environmental services is a terminology associated with the cleaning and disinfection of healthcare settings. And also, as we mentioned, it is a very critical part of infection prevention control in healthcare settings for reasons that we mentioned earlier. And those who actually perform a lot of the main part of EVS are who we call EVS technicians. And this is another technical terminology that is used in healthcare settings. And it is a terminology used for, or basically the title for, the custodial staff in healthcare settings. Is the technical term in healthcare settings. But they are not merely just, like some people may have referred or sometimes refer them as housekeepers or janitors, but they are not just merely housekeepers or janitors. Rather, they're specialists in a unique and vulnerable environment, and therefore have a very special body of technical knowledge and responsibility in infection prevention control measures. You can say that they are one of the most important members of the healthcare team because they protect the site, they protect the environment that the people are in, that the clients are in, that the staff are in. And so they play a vital role in healthcare. In a way, you can say that EVS technicians are the first line of defense of healthcare facilities, like a security system for clients and staff. And this is not to say that others do not have a part to play in EVS. Others definitely have a part to play, such as the nursing staff, the healthcare team, the administration team. Everyone has a part to play. As we mentioned before, it is everyone's problem and not just one person. And we all have to work together in order to keep healthcare facilities safe for clients and for ourselves, and in part for our communities and our families. And this is something that the COVID-19 pandemic has definitely reminded all of us, that we are all germ warriors. Cleaning and disinfection. Cleaning is the physical removal of visible soilage, such as organic matter, dust, soil. It is those very hard, crusty, or slimy, or gooey, or mushy things that you see on surfaces that is very visible. And the important thing about cleaning and disinfection is that these visible soilage needs to be removed before we can actually effectively disinfect that area, because the soilage actually provides that layer on top of the microorganisms that we're trying to get to with disinfectants. So in order to get to the microorganisms with disinfectants, we have to get rid of this layer of soilage. And secondly is the disinfection. And disinfection is the killing of the viruses or bacteria or the disease-causing microorganisms using disinfectants. And of course, there's different kind of disinfectant products out there as well, which we'll talk about. So generally, you'll see this in a lot of the general recommendations on the BCCDC website and others. The cleaning and disinfection is, of course, we want to do it at least twice a day, right? And of course, if there's any visible soilage, if there's any need, like if somebody had vomit on the floor or there is other materials on the floor, we want to definitely not wait till the second, period or second time that we are scheduled to clean. We want to do it right away, okay? And so therefore, that's why we say when needed. And we also want to do it after each client encounter. cleaning the equipment, cleaning the surfaces that has been exposed to the client. We want to make sure that we clean and disinfect those surfaces between clients, so not to allow for cross-contamination. And of course, as we mentioned previously, cleaning needs to happen before disinfection, because we want our disinfectant products and solution to be able to get to the microorganisms underneath that soilage. And one thing that we found that sometimes is lacking is the use of physical friction to clean. And we all have done it, or I'm just assuming that we all have done it. Maybe not, but for me, I've done it before. I've taken a cavity wipe or Excel intervention wipe, and I just take a swipe over the vitals machine, stethoscope, and the other examination surfaces, and it's like, oh, okay, all done. It's wet, so therefore it's disinfected. But that's not really the case. We have to actually apply physical friction because of the soilage and certain barriers that is on there that needs to be removed, that can only be removed with physical frictions, even the things that we can't really see, such as that sinister thing called biofilm. Now, although we'll speak more about biofilm in another Zoominar in this series, we would like to just touch on this topic very superficially. Biofilm is the material that is produced by microorganisms like bacteria on its surface, and it's like how do I say this without being too complicated? They secrete this structure created by proteins and polysaccharides, or we can just say slime. It creates a slime on top of itself, the structure that protects itself from the environment, from the harsh environment, so to be able to thrive in the environment that it is in. And so when microorganisms like bacteria accumulate together and produce this biofilm on top of themselves, it continues to produce more and more of it, this protective layer. So therefore, this protective layer protects it from being exposed to disinfectant solutions, to the environment, so to say. It makes it harder for disinfectants to get to the actual microorganisms underneath the biofilm. And one of the ways that we can remove biofilm is to use physical friction. And that is very important, physical friction. So it's not enough just to take a swipe at something. We actually have to put some pressure on that disinfectant wipe, on that surface, to really push down and apply that physical friction to remove this biofilm in order for the disinfectants to work. Another important aspect of disinfection that we should all be aware of is that not all disinfectants are made equal. There are different products out there with different proprietary blends and chemical compositions, different active ingredients, so to say. And therefore, we need to know the product that we're using, what it can do, what it can be used for, and how to be effective with it. One of the terminologies that some of you may be very familiar with, and it gets talked a lot about, is contact time. And what is contact time? Contact time is the amount of time that the disinfectant solution needs to be on that surface, or for the microorganisms to be exposed to that solution, in order for that disinfectant to do what it's supposed to do, kill the microorganisms that is intended to kill. And it can range from about 30 seconds to about 10 minutes, depending on the specific solution that you use. And so therefore, it is very important to know what is the contact time of the disinfectant solution that you're using. Is it 30 seconds? Is it 5 minutes? And sometimes we see people, wipe down a surface, and then it's like 10 seconds later, it's like, yeah, get another person in there. And that 10 seconds may not be sufficient with the disinfectant wipe that they use. So know the contact time, know how long you have to actually allow that surface to be wet for. And we sometimes also get questions about, about the disinfectant wipe, and people asking, well, what happens, like, do the manufacturers ensure that that surface can actually be wet for the contact time of that product? And one of the things that we commonly have seen when we have gone to some nursing stations is that some of the disinfectant wipes, the lid is left open. And so it allows for the wipe and the solution to dry out. Therefore, a lot of the wipes inside the container are already half dry. And so therefore, it may not have that sufficient amount of solution to keep a surface wet for the required contact time. So just be aware of that too as well, to make sure that you always recap these disinfectant canisters. So we talked about contact time. Many of the disinfectant products that are approved by Health Canada will have a DIN number, and there is a website on the Health Canada by Health Canada, which lists the disinfectant solutions and disinfectant products that is approved by them to be used. I believe right now that running list is COVID-19 specific, but a lot of those products can also be used as broad spectrum, being able to kill bacteria, viruses, mold, fungus. But you have to remember to always make sure that you read the manufacturer's instructions and know your product to see what it can actually do. Compatibility is another common issue that not many know about, and that is not all disinfectant solutions can be used on all surfaces. Some equipment, they're plastic, may not be compatible and may not be able to be exposed to certain disinfectant solutions. And you can void the warranty or destroy the product, or it may not be effective in disinfecting that product because of some degradation to the plastic or the material that is being used. So how do we know what is compatible? Refer to the manufacturer's information of use, abbreviated MIFU, of the equipment, and match it to the disinfectant products that you have. And we will cover more about compatibilities and product selections in a later Zoominar in the series as well. But suffice to say, just know that not all disinfectant products can be used on all equipment. One of the things that we do always suggest and we recommend and like to provide consultation on to people is how to find easy and simple solutions to infection prevention and control. And we always like to try to find easy and simple strategies. And so one of the things that we have recommended in terms of product selection is to choose equipment and other products that already is compatible or that is compatible with the disinfectants that you already use. And hopefully it's just limited to one of them. So you're not left like having to think about, oh, do I have to wear like a Batman utility belt and have different wipes on there and think about, oh, which one to use on which surface and which product. And that the easiest way is just to pre-select your equipment and products and make it simpler that way. How often to clean and disinfect? As we mentioned before, the general guidelines is twice a day. Clean the high touch surfaces and do a nice full cleaning at the end of the day as needed. Of course, for the examination rooms and for other areas where there is patient and client encounters and examinations, make sure that you always clean between clients. So for example, the equipment that is used on the clients, the examination tables that are used that the client sits on, or the chair that they have in the examination room, make sure that those surfaces are clean and disinfected between client use. And And one of the things that people sometimes do forget about is their stethoscopes. It is around the neck, so it's like you're looking at equipment, but there's also something that is around your neck that needs to be cleaned and disinfected as well. So what are high-touch surfaces? As the name implies, they are surfaces that are highly touched. Yes. Here's a diagram from, I think it's the BC Ministry Recommendations for Environmental Services. I'm sure that's not the exact name, but it's taken from a provincial document on EVS. And if you can see closely, I don't know if you can see this on the screen, but there are red dots on each of these surfaces, and these are the ones that indicate the high-touch surfaces in these diagrams. Things like the door handle, light switch, keyboard, mouse, chairs, tables, etc. But let's take a look at a more at-home kind of example. So this is one of the examination rooms at a nursing station that Tess and I visited. Can you, from this picture, identify high touch, some of the high touch surface areas? And let's take a look. Don't draw on your screens. All right, let's take a moment to see how many surfaces you can identify. And then we'll provide in the next slide some general areas, general high-touch surface areas that we have identified. Okay, next slide. So these are the ones that that we have identified, just general surfaces. I'm sure there's more, but these are generally speaking the common ones. Okay, next one. Here's another examination room. Can you identify the high-touch surface areas? All right, next slide. And these are the ones that we have identified. So routine cleaning versus additional precautions cleaning. There is a difference. Routine is, as we mentioned, is like the typical cleaning and disinfection, your twice a day, high-touch surface areas, use of your general disinfectants in examination rooms, in public areas, etc. But when it comes to additional precautions cleaning, it actually has more stringent protocols. It will require a certain type of PPE to be worn. It will require a certain disinfectant solution to be used, and there's protocols attached to it. How do we know that an area needs additional precautions cleaning? This happens when clients with a communicable disease comes into the facility and has been identified as having a communicable disease. And therefore, you'll normally see a poster, a sign on the door or next to the door, indicating additional precautions like contact precautions, contact droplet precautions, airborne precautions. You'll see those signage. And that indicates additional precautions that has been taken with this client and therefore requires additional precautions cleaning. And those protocols are usually found actually on the poster as well. And also in your algorithm as well that you will have in your cleaning and disinfection work. So when in doubt, if you do not know, especially during this time when everyone's rushing through things, if you do not know, ask your nurse, and they will tell you whether or not a person is on additional precautions or not. And Tess will then talk more about the technical aspects of cleaning. And so let's turn this time over to Tess. Now I'm going to turn it off to Tess, who will talk about the more technical aspects of the cleaning, and how to clean is the first one.
Hello, everyone. Thank you, Daniel, for that introduction. So before EVS technician would clean a room, there is some preparation that you probably already do. Some EVS technicians would use a checklist or some form of a note, something that reminds you of how is your process, how you would like to systematically clean a space. So one of the first things to do is to make sure that the area is clear of clutter. It is very difficult to clean any surface if a lot of the materials that are used for seeing or examining or treating clients are still on the surface or on the countertop or on a particular equipment. So the clinic staff would only ideally be bringing items that they need for one specific activity for that specific client, whether it's assessment or treatment. And so this way that the supplies are going to be kept in enclosed storage and not exposed to cross-contamination. So ahead of time, the staff needs to determine what equipment EVS are able to clean. There will be a discussion, or we suggest that you have this kind of discussion ahead of time before the client is there, or as part of your meetings when you're determining your processes for how you're going to do this with the other members of the healthcare team, so that you have a communication and a process on who is going to be cleaning what and who's going to be disinfecting a surface or an equipment. Because some of the medical equipment, the nurses might be the ones specifically trained to take care of those in terms of cleaning and disinfection. So who cleans which surfaces and equipment? What we recommend is that, and some of you might already have this in your healthcare facility, that there is a well-established service level agreement. Some would term this as a contract. So an employer and an employee would agree on what's included in the services that are to be provided in the cleaning and disinfection of a healthcare facility. And in it, it also says whose role and whose responsibility it is to clean something, a surface, an equipment. And these service level agreement contents are communicated with all the healthcare team members so that, for example, the nurses would know what to expect from the EVS technician, and the EVS technician, on the other hand, may not always have to be asking the nurses or other members of the healthcare team what it is and it's not for them to clean. The service level agreement will have all of those details. And so how do you make a space more cleanable and disinfectable? Here's another example of one of the nursing stations we visited. Take a look at the surface on the countertops specifically. Make note of how you might want to make this cleanable and disinfectable. You can pop it in the chat or just think about it. Yes, so again, to remember that before you clean, you would need to remove the clutter. So it's a partnership between the clinicians and then other members of the healthcare team and the EVS technician to make sure that the area is accessible, cleanable, and disinfectable. And in this slide, we have some diagrams of how to clean and what is the correct cleaning order. So generally, we would say that your rule of thumb is from the cleanest area to the most contaminated area. So when you enter a room, you would see and make some mental notes about, oh, how am I going to tackle cleaning this? You could start from the highest surfaces to the lowest surfaces, or from the outer edges of the room into the middle of the room. And so from high to low, from the outside to the inside, and from the cleanest objects or surfaces in the room to the dirtiest or more contaminated objects and surfaces in the room. And in the next slide here, we have a table that specifies considerations for equipment cleaning and disinfection. Again, the general rule of thumb is we recommend that the equipment and surfaces that are used in healthcare facilities are disinfectable, cleanable, disinfectable, and non-porous. So, for example, if there are materials that have so many little parts, so many nooks and crannies, and if the material used to make this is something that is porous, there will be many parts that are difficult to access or to clean and disinfect. So as a general rule, try not to have those kinds of materials or surfaces in the healthcare facilities. So I'll give you a few minutes to have a read of what's in the recommendations here on the table about items that are recommended to be in the healthcare facility, what we could do about it. The single-use equipment, which some of the nursing stations would prefer to use, you just discard after use, so there's no reprocessing or requirement to clean and disinfect. And for linens, we would recommend that the linens that are used for various purposes have a separation in terms of, for example, you have kitchen linens that are used for your other services. Those, our recommendation is for those to be reprocessed or laundered in a separate washer and dryer, separate from the linens that are being washed and dried in another set of washer and dryer for equipment or clean linens that are for the clinic areas. And the regular waste just goes to regular garbage bins that has liner. And just to remind yourselves that we take care not to have our clothes or uniform be contaminated by the edges of the wastebasket. And of course, as always, we would remind everyone to clean hands with soap and water after emptying the wastebaskets and after finishing your tasks. And if you don't have access to soap and water right away, use your alcohol-based hand rub. Next slide. So in terms of protecting yourself, these are some of the equipment that you use in the EVS closet. First, before you wear any of these personal protective equipment, we always recommend frequent hand washing. So you have to wash your hands before you wear your gloves, for example, before you wear your other personal protective equipment. And in here, you are also going to think about what is the task that I'm going to do and how do I protect myself from any of possible accidents that might happen. So then you know what type of personal protective equipment you will wear. And also to have a discussion with the nurse or other members of the healthcare team to let you know when it is appropriate to clean the room. And this is usually what we recommend is after the client has left, so that in case a person is actively ill or might be able to spread infection, you will be protected if you are not there in the room while the patient is coughing or the client is showing symptoms. And for these kinds of questions with regards to personal protective equipment, you can also contact your occupational health and safety representative or your employer with regards to safe work procedures and other safety equipment that they provide to you or you request as part of performing your job in a safe manner. And an infection control presentation will not be complete without a hand hygiene slide. So in here, we just have a brief presentation of how you wash your hands with soap and water. And on the other column is that if you don't have access to a sink immediately, you could temporarily be cleaning your hands and sanitizing your hands with alcohol-based hand sanitizer. And for this, for these two tasks, we would advise that the hand and arm jewelry are removed, and then you remove the visible contaminants with a wet wipe first before you use an alcohol-based hand rub. And it's so that those visible soilage will be scrubbed with a physical scrubbing back and forth to remove the organic matter so that the hand sanitizer will be able to reach the microbial organisms that are on your hands and be effectively able to disinfect and sanitize your hands. And just a reminder that hand washing is one of the most important and effective way to prevent the spread of infections. So the question that we also frequently receive is, when do we use personal protective equipment, or abbreviated as PPE? There's a couple of things to consider. First is based on the job specific hazards and requirements of the task that you're going to perform. There could be chemical exposures, biological hazards, physical hazards, or environmental hazards in the workplace. And so you look at the task that you need to do and make a mental note: how do I protect myself in case there's any hazard that happens, whether it's accidental or somebody comes and introduces something that was not planned for, that could be a cause of an accident. You will be able to make the appropriate judgment by doing this kind of assessment beforehand. And the second one is called, well, there's two things in this bullet: is the risk assessment and the point of care risk assessment. So a risk assessment is the employer's task to conduct these types of assessment in order to protect the employees from hazards that are preventable. For example, an assessment is done by the employer with some of the more senior staff and just checking out each task in the health center or nursing station and each area of the healthcare facility, and thinking ahead of time, what could be some of these hazards that are encountered in these spaces or in these procedures, and then to create some processes on how to prevent these kinds of accidents or incidents, so that everybody in the healthcare setting is safe. Next slide, please. And the point of care risk assessment is the employee's responsibility. So every time before you do a task, there is this moment that you need to pause and just collect your thoughts and plan on what you're going to do. What is the activity, and what could be some of the hazards that you will face when you're doing this activity? And then create that plan on what kind of personal protective equipment or what kind of procedure you're going to do in order to be able to do the task and do it safely for yourself, for the other staff and clients. So it is part of the responsibility of each healthcare team member to do this assessment to keep everyone safe. And so some more of the personal protective equipment considerations. This poster here, it just tells us that not because you are wearing every single personal protective equipment of each type that you could get your hands on, then you will get this feeling that, oh, then I'm so well protected, I will not face any harm or hazard because I have every single thing on me right now. That is not the appropriate attitude that this poster is trying to say. Because sometimes when you're wearing more pieces and layers of the personal protective equipment, there could be more instances that when you're either putting it on or taking them off, that there could be an area of cross-contamination to yourself from the outer parts of this personal protective equipment. So use the risk assessment and the point of care risk assessment that we talked about in the previous slides to do your mental preparation of how you would be putting personal protective equipment and for what reason. So what are the general considerations if we don't know what kind of infectious disease a client may have? How should you proceed to clean the room? So I'll give you a minute here to think about what kind of problem solving you're going to do. Okay, so yes, the correct answer is that you will treat everyone who comes to the healthcare facility as infectious. It doesn't mean that you can come to the nurse or other members of the healthcare team and ask what kind of infectious disease a client may have, because there are rules about privacy and confidentiality. You may be able to ask the nurse when they're saying to you, oh, this room is now free and you can clean it. You can say, is there anything special, anything that I need to know in terms of my way of cleaning this room? And then they're just going to say, oh, it's just general, so nothing to worry about. And so having some kind of a conversation, if you are unsure, is always a good idea to protect yourselves. Next slide. Then the last part of our presentation are various resources that you can use in order to support you with the tasks that you do. Say, for example, the First Nations Health Authority Housekeeping Manual. And a lot of these are posted in our website. There is also the COVID-19 recommendations for cleaning in community healthcare settings, and also infection prevention and control measures for client transportation. And various other COVID-19 specific information from Ministry of Health, Public Health Agency of Canada, Center for Disease Control, and again, our FNHA webpage. And these are other references from PICNET, BCCDC, and other health authorities. And thank you very much for your time. Again, feel free to reach out to us if you have any questions, ipc@fnha.ca. Thank you very much.
Thank you, everyone.